Thank you, Lauren. Well, it is that time of the year, summer, and summer is always full of injuries. That's why we have Dr. Lori Michael and Dr. Gregory DiFrancesco of AccelCare. Now, you usually probably think if I have an injury, I'm going to go to the emergency room, but you might have better luck with an urgent care facility. So let's start by just sort of touching base and talking about what urgent care actually is and what they treat.
Sure. Urgent care treats a wide range of illness and injuries, ranging from the common infections like strep throat, bronchitis, or pneumonia, to fractures, dislocations, stitches, and other minor surgical procedures. We can also perform laboratory testing and x-ray right on site. We can do all the rapid testing such as strep, mono, or influenza. And we can even run basic blood work on site and have test results back in about 10 minutes or so.
Now, one of the interesting aspects of urgent care is that it's actually its staffing model. So what makes urgent care a little bit different than an emergency room in terms of staffing?
Well, our staffing model at AccelCare in particular is that we have a board-certified physician on at all times. Often it's going to be an ER physician simply because AccelCare is owned and operated by a group of ER doctors. So every patient that comes in to the clinic is going to be seen by an MD, treated and released within about an hour, and seen by an ER doctor without actually having to walk into the emergency room.
And since you're training so closely with ER doctors, is your staff well diversified?
Yes, very well diversified. We treat all age groups. We are very comfortable with taking care of the 2-day-old, the 90-year-old in our emergency departments every day. So pediatrics in particular can be a concern, I think, for not only families but pediatricians. We are very comfortable treating pediatrics. We created a pediatric treatment room immediately across from the nurses station, and it's outfitted with all the nice kid-friendly touches that I think will make families feel comfortable.
Now, what about insurance? Do you take all providers?
We accept all major insurance plans in this area. We accept all Medicare and most Medicaid lines of business. Perhaps most importantly, with the growing uninsured population we have in Buffalo, we have extremely reasonable self-pay rates for those folks.
Now, so if something happens this summer, you're about to head to urgent care or the emergency room, is there anything that you might want to avoid urgent care for?
You know, one of the things we actually stress that patients call their primary care physician before they're coming to urgent care, and their primary doctor can direct them as to where the most appropriate place to go is. But generally for minor types of illnesses and injuries, urgent care is the appropriate place to go. If you're having chest pain and shortness of breath and you have a history of heart disease, then obviously the emergency department would be more appropriate.
All right, well, thank you guys so much. Now we're going to head over to the newsroom to see what our Channel 4 team is working on. What's going on over there, Joe?